Well done. This is the Working in Partnership Award, and with me is Rachel Woodington, Head of Nursing and Quality, Yorkshire Marie Curie, and Fiona Hargreaves, Palliative Medicine Specialty Trainee. And this is the Marie Curie Responsive Emergency Assessment and Community Team, or REACT for short, and Marie Curie Hospice Bradford and Bradford Teaching Hospitals NHS Foundation Trust. Congratulations. This is really interesting, and we were just saying this is the second palliative care award. Palliative care, which often doesn't get much mention, which I don't know which one of you wants to take this, but why did you see the need for this?
So I think it was recognised that Bradford is got quite a lot of social deprivation, and actually there was a lack of access to palliative care of the population, and that people were presenting in crisis to A&E. Without having had any input from palliative care, and often not even being known as a palliative patient. So sort of the project was created in collaboration with Bradford Hospital and Marie Curie to try and reduce those admissions in an emergency and provide urgent care outside of the hospital.
And what's been the outcome?
So there's been a significant reduction in bed days for people coming into the hospital. So I think it's come down from over 30 to down to 17 in the last year of patients' lives. There's been we don't like to talk about numbers, but there's been a big cost saving as well. I think over £1 million in comparison for the cost of the REACT project to what it would have cost for those patients to be in hospital. But also for the patients and their families, they're having a much more positive experience of that difficult stage of their life where they otherwise would maybe be in hospital, not able to have the people around them in an environment that they're familiar with. They're actually getting that input where they want to be, and that feedback's been really positive as well.
It's really traumatic, isn't it, for a patient coming to the end of their life to be moved back and forward from hospital, going into an ED department, which is just not the place you want to be. What sort of feedback are you getting?
We get absolutely phenomenal feedback. All patients and carers are offered a chance to feedback into the service, and it has been 100% positive feedback for staff. There's a lot of people that are very nervous about going home, or there's cultural issues that will stop them going home for palliative or end-of-life care, and actually REACT have helped reduce those concerns, and it's been right for the patient and right for the family, and that feedback just drives our service continuously.
Well, that's pretty good feedback, it has to be said. Couldn't get any better. But this is called the Working in Partnership Award, and I want to try and unpick how you create that partnership.
So I think identifying those key stakeholders. So we were very lucky that we had real encouragement and buy-in from Bradford Hospital Teaching Foundation Trust, and there's been ongoing buy-in and support from the A&E team there, but also from higher up within the management team. We were able to get some funding opportunities through social finance, Macmillan, Better Social Care, National Lottery Fund, to kind of actually start this project off the ground, because that's often the challenge. Bradford have very kindly continued to fund this project because they've seen the benefit both for the patients but also the financial benefits. But we were able to get that off the ground with their support. And I think it's been that ongoing conversation between Marie Curie, the hospital, making sure that actually if something's maybe not worked, we're addressing that, but actually when it's working, we're promoting it and continuing that kind of dialogue really between them.
Yeah, and I think what it's allowed us to do is be present in the ED department as a team, and on the days when it's often full, as every ED department is, it allows the REACT team to be able to identify those patients that actually clinicians who are extremely busy might not have the chance to do, and I think they really appreciate that from their viewpoint, but from ours as well, and it allows us to work with the team. The relationship that we've got with the Bradford medical team and nursing team is fantastic, which is why we are where we are today.
So in practical terms, you've got a patient there in ED who's been identified. What happens then?
So essentially we attend the board round, or it's identified that somebody in the morning board round would be appropriate for REACT, and then that patient is then reviewed by one of our teams, so whether that's a doctor or one of the nurses that comes and reviews them, and we identify what actually is needed. So it might be that actually that patient is known to palliative care and there was an issue with a symptom or an unmanaged need that we could address, but it might be actually that they're a new presentation of somebody that unfortunately has just had something catastrophic happen, and actually the priority is to get them home. And then what we would then do is help arrange urgent transport if home is the right place, and if it's not home, then address those symptoms in ED to bring them into hospital. And then we would then, as I guess REACT stands for, we would then try and visit them as soon as they're home to basically see what the home environment is, see what medications we need to get in, equipment, maybe personal care, and see, actually just be there as a listening ear often to kind of understand exactly what those needs are, because it's normally a medical problem that's brought them into hospital, but actually that's probably driven by other things, whether that's kind of a lack of support or just things changing quicker than expected, and we can help that.
It talks here in the blurb too about addressing health inequalities. How does it do that?
Bradford has a number of health inequalities. I think it's the 13th most city and town in the country that has deprivation, and a lot of unmet palliative care needs. And culturally, there's a lot of differences around palliative care and where that care should be received. And I think we're trying to break those barriers about that actually palliative care doesn't need to be given within a hospital environment. We can actually do full holistic care within a patient's own home, and we can support culturally in regards to providing translators and support. We can provide help with getting benefit packages in, finance packages, supporting with equipment, carers support, counselling pre and post bereavement. So it is
Gosh,
everything really.
Yes. I mean, really, that's quite a lot of input, isn't it?
Yeah, absolutely.
So what's next?
So obviously we're delighted that our project locally is being kind of sustained and funded. We'd like to see this project being adopted elsewhere, and sort of encourage questions about it. I think Bradford is unique in some of its population, but actually this model could be adopted by lots of different areas to try and improve access to palliative care and reduce that emergency admission and keep people where they want to be looked after.
So nationally, Marie Curie can be having this conversation, can't it?
Absolutely.
Yeah, we have been, and there's different models that are going into different ED departments, but REACT remains a very standalone model across the country at the moment. But there is new ways and innovations working throughout ED departments across the country.
So you must have huge buy-in from the ED departments, because I know from my own family experience, when you're in this situation and the ED department's so busy with other things, with people actually who can be brought back to health. And then there is the person who really there is nothing you can do medically anymore. Yeah. What are they saying to you? What's the feedback from the departments?
I mean, they are incredibly grateful to have us. And I think there's an overarching sort of sense of, actually quite a lot of relief. Working in the NHS sometimes can be really, really demoralising and difficult when you're feeling like you're stretched so much and you don't have the time to spend with these patients. And actually us being able to say, you know what, don't worry, we'll take them off your load and you focus on the other patients.
There's
that you've got.
Territorial problems.
Not at all. And I would say that it is the definition of working in partnership. I've seen patients in ED myself and gone, actually, I'm not sure this person is a REACT patient at this point. Can I kind of send them back to your way, and vice versa? Patients may not have been identified as appropriate for REACT initially, and then with a bit more digging, the ED team might come and find you later on and say, oh, actually, could you pop in and see them? So it's very much, I think they really are grateful, and we're very grateful for their sort of pick up and kind of ongoing support really of the project.
Absolutely.
Good. Well, so many congratulations,
Thank you.
and I'm sure we will see it slowly being rolled out in other places, because you've presented a very good business plan apart from anything else.
Yeah.
But congratulations.
Thank
well
you.
done.
Thank you very much. Thank you.